Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, guest host Keisha Pollock-Porter returns to the podcast to talk with Daniel Webster and Josh Horwitz, co-directors of the new Johns Hopkins Center for Gun Violence Solutions. Webster has directed the Johns Hopkins Center for Gun Violence Prevention and Policy since 2012, and Horwitz has served as the executive director of the Educational Fund to Stop Gun Violence for almost 30 years. The new Center for Gun Violence Solutions is a merger of these two institutions that will focus on research while expanding evidence-based advocacy for effective and equitable policies to end the trauma of gun violence. Let's listen.
I am so excited for this conversation. Daniel, Josh, thank you for being here. And I'm really excited because of this new initiative we're going to talk about that really has the ability to be a model for the school, for the nation, really, about how we take good science and translate it into evidence-informed solutions that can make a difference. And so I want to unpack that today. And Daniel, let's just start with the short description of the center that you've helped lead at Johns Hopkins for 21 years. Tell us more about what y'all have been doing.
Yeah, so we were the first academic center that formed to address the critical questions around gun violence, particularly gun policy questions and issues. We're a diverse team that's actually growing. I'm very excited about that. But yes, we do some sort of foundational epidemiology kind of stuff, but a lot of our studies are oriented towards answering kind of what worked questions. And that's what we're known for, both on the, when we're talking about gun laws, but also about community programs and law enforcement approaches. So that's what our center has been doing and been known for and really quite proud of. We had the first course to address gun violence in a school of public health. We're the first academic center to address this problem of gun violence. Again, going back 26 years, we've grown over the years and have an increasingly large and diverse group of faculty from different disciplines and examining slightly different issues. I'll mention just a few. Our deputy director, Casker Fossey, has been leading research in a number of really exciting areas, including licensing of laws for gun purchasers and doing homicide reviews, which is an area that we're going to work on more as a newly formed center. Shannon Frateroli focusing on extreme risk protection orders. We have Dr. Jackie Campbell doing foundational epidemiology on the connection between availability of guns and domestic violence. And new Bloomberg Distinguished Professor Otis Johnson looking at a variety of equity issues as it relates to violence. So we're a very diverse group, but we're very focused on policy questions, things that are really going to get us to the answers about what is most effective in addressing the problem of gun violence. And we do that, of course, from a public health lens and orientation. We're very much oriented towards community impacts of a variety of approaches and strategies to address gun violence.
Great. And thanks for mentioning some of those examples. I know that there are far more people than who you just lifted up, but thanks for giving listeners a sense of the kinds of work that you're doing.
We've been very intentional about trying to have our research actually inform policy, but we have a limited bandwidth, and we're not experts in advocacy. We are experts in research and in the problem of gun violence. And now this is sort of a transformational kind of opportunity for real impact. Yeah. And so that's sort of short history of who we are and what we've been doing.
Definitely transformational. And to that, let's segue to Josh. Josh, tell us about the Educational Fund to Stop Gun Violence and how your organization approaches gun violence.
Well, thanks, Keisha. Thanks, Daniel, for having me today. I'm equally as excited about this. This is a big change for us, but it's really a continuation of the work that we've been doing. So the Educational Fund to Stop Gun Violence was formed in 1978. We've done a lot of different things, but under my leadership, we've really focused on a public health approach. And the way we do that is we take the great research that Daniel and his team do, and it's very policy relevant. So what we want to do is work with researchers across the country and think about what's called research translation. How do we take that research, the data that's part of that research, and get it into the hands of people making critical decisions? Where are the opportunities to make change? Who has a problem they need to address? What can we bring to them in a one-pager or a short report that is going to give them the information they need to make a real meaningful change? And we do so research translation is something we do a lot of. Second thing is advocacy. So looking for those critical opportunities, looking for where we think the law should change, looking for how we can inform a coalition of advocates, how we can inform legislators and policymakers and people making administrative decisions. Can we bring the power of research into the advocacy realm, right? Who's got the power to make decisions? What do they need to know? And can we inform them, push them, cajole them, educate them in a way to make important changes? And the third thing that we do is we want to make sure that we're doing it with strong community partners. We have an approach, and that approach means that we must do that in concert with community members, people being affected by the decisions, working together with them every single day and building those infrastructures for community power, for community gun violence prevention. And the last thing I'll say is that I've also, as part of this effort, been leading the Consortium for Risk-Based Firearm Policy. That's a group of academics from around the country looking at the risks around firearms and putting together new solutions. And so I'm used to working in that intersection of academics and advocacy. This just makes it my job every single day, and I'm just thrilled to be part of this.
In describing each of your organizations, I heard you both mention the word equity, which is something I care deeply about. And I think we can't talk about gun violence without talking about the significant inequities and the disproportionate impact on communities of color, on Black and brown people, low-income populations, et cetera. I can go on and on and on. Can you talk a bit about how equity shows up in your work? What does it mean to sort of think about centering equity research or equitable solutions to gun violence? I'd love to hear you both sort of share this perspective with the listeners.
I think when you think about equity, at least for the way I look at it, the Educational Fund, and now in our new center, you have to think first about us ourselves. Are we doing equitable practices? Are we focused on equity within the organization? And that's broadly, right? It can be gender equity and mental health equity and racial equity. But are we trying to figure out how to make our organization equitable? Are we thinking through all the processes that we use, from hiring to promotion to who gets to access to the media? And so thinking about ourselves is very important with this. But then also thinking about the solutions that we propose. And what are the benefits of those? But what are there potential inequities that we could exacerbate through that? We know that incarceration, right, can really play a role in inequities. And so what are we doing is that when we think about solutions, we want to make sure that we're not just thinking about, okay, here's what the public health data sort of about one policy says, but how's that going to impact that? And how do we think about those systems? And actually going back, is there an opportunity to change the systems and make those systems better? So when we think, we have really adopted, and we worked actually with Daniel and Daniel Center on this, a racial equity impact assessment tool and process. So that we're actually looking, before we embark on a policy or an advocacy campaign, we want to understand what we're getting ourselves into and what the things that are going to be beneficial from it, and where do we have to be careful that we're not exacerbating inequities, and how do we work to solve that? And then how do we keep an eye on that through the process? So we've developed a tool, we use it, and we're looking forward to using it as a new center, but also teaching other people about the way that we approach public health, which we think is a helpful and on an equity journey to make ourselves a better center.
Thanks, Josh. And thanks for mentioning the racial equity impact assessment, the RIAs that we call them out in the world. And so really, that's near and dear to my heart. So I'm just excited that that work's coming into department. Daniel, what about for you?
Yeah, I'd like to talk about this in very specific terms about a prior research project and then one we're just now launching. So in a report that we issued in 2020, we focused on gun law enforcement issues in Baltimore City, recognizing that Baltimore sadly has suffered an incredibly high rate of gun violence, very large degree of racial disparities in terms of the victimization of that. And gun law enforcement has been seen as a mechanism by which to address gun violence. But what we've know from our own research is that, yes, done certain ways, certain gun law enforcement that is highly targeted towards the places with a lot of shootings and ideally with intel about who's behind those shootings, we see significant reductions in gun violence. But in Baltimore and many cities, the practices are not highly focused. They're very racially biased and harmful. They erode community trust that is really critical to public safety. It's not only from a justice standpoint, but for public safety purposes, equity is central. In that project, and hats off to Dr. Casker Fossey and Shawnee Buggs for doing surveys in the most impacted communities to get their own views. What do they want and expect from law enforcement as it relates to illegal gun possession? What kind of accountability processes to prevent abuses by police, for example? And we did focus groups there as well. And we came up with a very, evidence-informed, community-informed set of recommendations for changing how gun law enforcement occurs in Baltimore City so that we both are reducing gun violence and those inequities and victimization, but we're also reducing inequities on the enforcement, prosecution, and sentencing side. Mandatory minimums are one of the things we said are just leading to unnecessary incarceration. We have a new study now that we're just launching that's going to look at very specific gun policies and their impacts on both arrest and incarceration, and of course, in the racial disparities on both of those outcomes as well. So we're very excited because when we do racial equity impact analysis right now, there's hardly any data to actually guide that process. So we have a new grant from the Joyce Foundation to bring that data so we can do appropriate assessments. So we know when we're looking at a policy, what's going to be the impacts on victimization, on arrest, and incarceration.
One of the things you mentioned was sort of the internal work. And so I think that there's probably some lessons there, some things that we as a field, as a school, as a department can learn from you. Can you talk a little bit about how equity is showing up internally in your organization?
Yeah, I think that's an important thing. One of the things that we realized is that you can't sort of do this sometimes and not all the time. And so make sure that we focused on this. We actually developed a program within our organization that's staffed by with two folks who focus on equity. We have an equity director. We look at all of our communications. We look at our reports. We talk when we develop a project. A member of our equity team helps us develop that project in a way that we hope that we'll have equitable outcomes. Now, that doesn't mean we're perfect. We do slip up. We do make mistakes. But we are trying to hold ourselves accountable by bringing experts in equity within our team. And we're excited to bring that team with us to Hopkins because they do great work. They are successful advocates in their own right, but they also remind us through their work that we need to do these racial equity impact assessments and we need to make them more than perfunctory. We need to live that. And so you have to focus on that. And I think you do that by hiring people, by hiring and developing positions about equity within your organization.
And I'm thrilled to be the department chair for this partnership. I mean, I am an academic who leans into research translation, policy engagement. So I'm just thrilled personally. But I have to ask the question, you both lead outstanding organizations. You are strong individually. Why merge? And what's the vision for this new Center for Gun Violence Solutions? And I want to say, I love the name. I love the intention of adding solutions in the title. So whoever wants to respond first.
I'll start. and I sort of alluded to this earlier, is that, again, we pride ourselves on our research and our ability to sort of communicate to the public. We have a very limited bandwidth when it comes to actual advocacy for change. And this new merging with the Educational Fund to Stop Gun Violence just completely puts us in a different place and ability to impact. We all come to this, yes, we're intellectual, and so we're satisfied by sort of the enterprise of research, but we're doing this because we want to save lives, ultimately. We want to improve lives and reduce trauma. And we recognize research is powerful, but it's only powerful if it's translated and used appropriately. And that's why this is so exciting. And yes, we've done stuff collaboratively before with Josh and his team, but I think it's very different when we literally, day to day, think about the same kind of problems and how we can solve them and have an impact.
Yeah, thanks, Daniel, for that. What about you, Josh? I mean, why merge? And what's your vision for this new center?
Well, I think we share a vision, and it's to take research into advocacy every single day. And there's sort of three core principles that I think we bring to this. One is this has got to be grounded squarely in public health. There's a lot of discussion about what public health is, but when you're at the school, probably the most outstanding public health institution in the world, that says something about our theory of change. It's public health. It's the tools of public health, the type of analysis, the type of evaluation public health does so well. We want to be squarely in that realm. So this is about public health. Number two, public health doesn't stop us from dreaming big, right? We want big change. And actually, when you think about big change around the world, public health is the type of thing that actually brings that around. So we want to dream big, and we're talking about substantially saving lives. We don't want to be nibble around the edges. We want to be right in the thick of it. We want to dream big and see if we can save as many lives as we can. But we want to do that with specific policy recommendations and specific programs. And that's where this merger is so important. Daniel and his team have thought about those programs. We've thought about making them work in the world. And I'll go back to that phrase, work in the world. But together, it's like dream big, but have that specific public health plan that makes it happen. And we were going to tell people through our websites and through our communications what exactly we need to do to make our dream come true. And so that's something that we're going to really focus on. So public health, dream big, but very specific and well-tested solutions.
Yeah, I love that. And I love thinking about how that comes together with the science, with the research, which we are so good at. And to that end, I mean, Daniel, some might wonder whether this new center and its mission might change or even, dare I say, compromise the center's research. What's your response to that?
Yeah, thanks for asking that. We've been doing research in this politically charged environment since our existence. We began 26 years ago. We've never compromised on any aspect of our research before, and we won't moving forward. Research and sound science is going to guide what we do on the policy and advocacy front. We have many examples in which our research has shown null findings for certain gun laws that some advocates really like. And we tell it like it is, and we will always do that. We ultimately are looking for solutions that work. We think the science is the way to determine what those best solutions are. So we've never been afraid to be clear-headed and convey whatever the data say is the best way to reduce gun violence. And so our advocacy goals may change as the science change. I suspect it will.
Mm-hmm. And Josh, to your point earlier, you emphasized the research translation part of this. Why is that so important for you? Why is this grounding in science so important for the advocacy work that you and your team have been doing?
So I think when you're a good advocate, I think the minimum you need is the truth and the science on your side. Now, it may be that there are political forces sometimes that overwhelm that. But for us, because we don't go in, we're not going into an advocacy situation with $1 billion to spend on advocacy or whatever. But what we do have is the science. And whenever I've been involved in an advocacy campaign, you need to have the science, the data working for you, and being connected to the people who are making that. Of course, they're going to be doing it the science the best way we know how, objectively, nonpartisanly, getting to the truth of the matter, but then giving us those tools to go forward and do the education that needs to get done. And I've never been part of a successful advocacy campaign where you didn't have the science on your side. You've got it. It's what we do. It's core to who we are. And to be effective, I think, especially in the public health space, you've got to have this well thought out, well reasoned, with the science and the data working in your favor. And going back to what Daniel said, we always reserve the right to get smarter. As the data changes, that's not a sign of weakness. That's a sign of smartness, right? Of saying, we understand this a little better now. We know how to do this to save lives. Let's use the most available data, and being right where the data is being made, like close to that, and learning from the experts. And I was on a call earlier with some of the other affiliated center experts, and I was just like, oh my gosh, any issue that I want to learn about. We were talking today, Daniel, about potentially developing a curriculum around gun violence prevention. And there's an expert right in the center already who says, I know how to do that. I've tested these. I've evaluated these. So when we think about new solutions, to have the expertise at the Bloomberg School of Public Health at our disposal is just, it gives us so much advocacy power that we're just incredibly excited to be part of it.
Yeah, you mentioned advocacy power. I mean, one of the things I'm really excited about is, as a chair, this really allows us to lean into the part of the strategic plan for the school around the power of advocacy, which is something Dean McKenzie lifted up. And, Josh, when you think about you and your advocacy team's affiliation with the Bloomberg School, how will that impact your work? What are you most excited about?
Well, I'm an adjunct at the school already. And so I teach at the school, so I understand the students that we work with and what the capabilities are. And I'm just really proud of that affiliation. And I know that when I sit in a room, and even if I'm talking about my role as an adjunct, never mind being the director for the Center for Gun Violence Solutions, what kind of respect that gets and how people lean in and listen. And the reason they do that is because you're giving them the best science. And so I'll be honored, but I also think it will impact the advocacy because the credibility that we bring will be increased and we'll have a global brand on our side. And so, I work for a modest organization that's had a lot of success, and we're going into now a bigger enterprise that has a global reach, and that will just expand our advocacy.
Yeah, I'm so excited. And particularly for you two coming together, you're both leaders coming together to really lean into the shared vision for how we can amplify our work, translate, inform policy and practice and programs. I'm just thrilled that you're both going to be the co-directors of the Center for Gun Violence Solutions. Again, I'm embracing the solutions part of this. So thanks for just taking some time to chat with me about this new exciting partnership. I hope that you'll come back. And I'm not only asking because I'm chair of the department you're in. I just want you to come back and tell us how it's going. Because again, I think this is such a model for the school, a model for the nation about how do we bridge science and advocacy in a way that is effective and makes a difference. So thank you both for your time today. Really appreciate it.
Thank you, Keisha.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.